Yes. So hip disassociation is a really, really important aspect that we use when training people for the simple reason that it's important for our gait cycle. And it's important for the strength of the hip flexors and the hip extensors in their ranges. Hip extension is about 15 to 20 degrees, and hip flexion is about 120 degrees depending on the flexibility of the hip extensors. When we teach hip disassociation, it means that the femur can move freely in the acetabular socket without any change happening in the pelvis. In other words, there's no posterior tilt that happens, there's no anterior tilt that happens, and there's no lateral tilt that happens. So therefore it happens in flexion, extension, abduction, and adduction. When she lifts this leg up to 90 degrees, she's got to maintain, let's say, a 5% effort of the lumbar back extensors so that they do not collapse into the mat. If she doesn't, she's going to go into a posterior tilt. So her brain has to coordinate that immediately. As she places this leg down, she's going to maintain lower rectus abdominis so that she does not go into that anterior tilt. And that's what you're going to teach them, is as you lift your leg, maintain lumbar back extensors. As you place the leg down, maintain lower rectus abdominis. However, then we go into what we call hip flexor abdominal coordination, where the lower rectus abdominis and the hip flexors have to coordinate to work together. If they do not, when she lifts this leg up, she's going to go into an anterior tilt because she's let go on her lower rectus abdominis. When she places it down, it's going to stay exactly the same. So hip flexor abdominal coordination and hip disassociation go hand in hand. Lift this leg up for me to 90 degrees and the other leg up for me to 90 degrees. Then she's got to maintain hip flexor abdominal coordination. When this becomes heavy and her lower rectus abdominis actually has to hold the position of her pelvis. As her legs move away from her, extend them out for me, lower rectus abdominis is really pulling on the front of that pubic bone to make sure that she doesn't go into that arch. She's got to pull it back with her lower rectus, keep those legs exactly where they are, and gently pull them back in. Place one leg down, and the other leg down. So just to recap, hip disassociation, place this leg down, is lifting this leg up freely in the hip socket without any change happening in the pelvis. Hip flexor abdominal coordination is as she extends that leg out and the hip flexors have to work more, holding the weight of the leg and gravity wanting to pull it down. Her lower rectus abdominis is able to maintain the position of the pelvis. Bring the leg in,